I recently am dealing with a child who has something which you get like a neurological deterioration or degeneration of the brain. Although it is a genetic condition, it may not necessarily be familial. And knowing a particular type of epilepsy in this case is helpful to us because we can tailor the medications in these type of epilepsies.
Dr. Shehnaz Ibraheem, Paediatric Neurology often involves collaboration with other pediatric specialists. Can you discuss a case where interdisciplinary teamwork was critical to diagnosing and managing a neurological condition in a child?
So there's no particular case that I can offhand remember. Almost all cases require a lot of interdisciplinary actions. For example, I recently am dealing with a child who has something which you get like a neurological deterioration or degeneration of the brain when a child has had measles in the past. We call it the subacute sclerosing panencephalitis. Although we are dealing with that condition, it is a progressive condition, we are dealing with it, we need a dietitian to deal with the particular kind of diet that we are trying to use. That child developed urinary retention, so a urinary infection, and therefore we need a kidney specialist in that, where the child is not able to pass urine. We need physical rehabilitation, we need occupational therapists, and so on and so forth. We need a gastroenterologist. So neurology is a multidisciplinary team which is related to a lot of fields together, and that is why working in an area where you have these kind of support is very important.
How do you approach the diagnosis and management of developmental disorders such as autism spectrum disorder or attention deficit hyperactivity disorder in children with neurological symptoms?
So it's a very important area nowadays. Somehow autism, even attention deficit are somehow conditions which we see more than what was seen 10 years ago. There may be a lot of reasons for it, but diagnosing a child with autism is not difficult. Children usually have very poor communication skills. They have very poor eye contact. It's not about intelligence. They may be very highly intelligent, but they have poor social behaviors, and their interaction with other children is at fault. In attention deficit, children are usually unable to focus, they are failing in school, they are not able to concentrate, and a lot of things may act as a reason for this, and you need to really take a very good history and physical examination in both these conditions to understand how you're going to help the parents overcome these problems.
Can you describe your experience with managing epilepsy in pediatric patients? How do you tailor treatment plans to account for factors like age, comorbidities, and seizure type?
So, epilepsy, I feel, primarily is a pediatric issue. And epilepsy 10 years ago was a totally different ballgame. It now involves a lot of genetics in it. And depending on whether we are able to get the genetic diagnosis, I'll give a very brief example. There is an epilepsy which is aggravated by heat. So the child has fever and develops seizures. And this kind of epilepsy is particularly a sodium channel epilepsy. Now, although it is a genetic condition, it may not necessarily be familial. And knowing a particular type of epilepsy in this case is helpful to us because we can tailor the medications in these type of epilepsies. There can be epilepsy which is post-traumatic, and those are different types of epilepsies. You can have epilepsy in cerebral palsy. You can have epilepsy primarily as an idiopathic condition where you don't know why the cause is. So there are different types. The armamentarium of drugs nowadays is increasing day by day. So we have very good drugs. The other important area which I really feel where my expertise is what we call the diet management for epilepsies. This is called the ketogenic diet. In severe conditions of epilepsy, where the child is on 4 or 5 anti-seizure medications, sometimes putting them on a specialized food which is very low in carbohydrates and high in fat tends to help control the seizures quite effectively.
Communication with parents and caregivers is essential in pediatric neurology. How do you ensure effective communication and support for families, particularly when discussing complex diagnoses or treatment options?
So pediatric neurology is a complex condition. Pediatric neurology is not as simple as ABC. Most of the time, parents have a million questions, and it takes time, patience. It takes a lot of counseling. For me, the most important is talking to the parents to make them understand the importance of what we are doing, why we are doing it, and unless we are together in it as a team with the parents, it will not work. So a lot of times parents come and they stop the medications, and if you have not counseled them appropriately on the importance of the medication, of the timings of the medication, the dosage of the medication, because that also is not what you can use in a cup, or you can't use a spoon, because every ml makes a difference.
With the increasing prevalence of pediatric neuroinflammatory disorders like acute disseminated encephalomyelitis or pediatric multiple sclerosis, how do you approach diagnosis and treatment in these cases, considering the unique challenges of pediatric patients?
So these are very different and very highly specialized conditions. Most of the time, when I was in my medical school, MS was a disease which was seen in the European population, say for example. But even in adults now, MS and Parkinson's is getting more and more. We do see MS, but primarily white matter demyelination for us would be either an acquired demyelinating condition, which is a DEM as you call it, which is most likely a post-infectious condition, or it is either a demyelinating condition which is hereditary. So white matter disorders are sometimes conditions which run in the family, and again require a very detailed examination, history, progress. And again, let me tell you, nowadays most of these genetic disorders which we used to think had no cure are now getting better and better at diagnosing, and then there are newer therapies getting available for a lot of them, although they are very dear in the cost, but we do have them available, and approaches are changing with times.